Hi, my name is Vadia Soya. I study support and innovation in health and social care. I will be presenting continuous professional developments. Continuous professional development is a way that individuals will continue to learn and develop their skills throughout their working career. It will give the healthcare workers the ability to practice safely, effectively, and legally. A personal critical incident has been analysed using the Gibbs model of the Gibbs model cycle, and it helped identify skills that has reflected on the incident. Compassion, values, and professional behaviours has been displayed. The nature of practice development is a process that a continuous action uh, is being taken to keep developing and improving the effectiveness in person-centered care. The means are through the development of skills and knowledge, enables the teams in healthcare to transform culture and context of care, and also skilled and experienced facilitation. This is when all the actions are easily and smoothly um, achieved due to the skills and the experience of healthcare workers. Person centered care is all about respecting the individual's distinctive needs, preferences, and values. Um, these example of these are asking questions about their preferences, giving them choices to pick from. You're assuring them that you are there to meet their needs and always have information about the patient's backgrounds and medical history. This will enable the healthcare workers to provide outstanding support and effective care. Treating patients with compassion, dignity, and respect will make the patient feel more confident and comfortable when using the services. Planning a continuous professional development. First of all, you need to assess the current situation. You need to ask questions like how much your career is progressing, how much continuous professional developments have you taken on, and was it enough? Then you need to identify your goals. You could use the SMART plan to help identify goals. SMART stands for specific, measurable, achievable, realistic, and timely. You need to consider the goals that will be achieved, asking yourself how they will be achieved, identifying the resources required to meet the goals. Forming a timeline could help you focus more, as having a time frame, you would work towards that goal in a more planned manner. Also, tracking your progress. Changes in health in the healthcare sector. The values and purposes of the health and social care sector will always remain the same, but health settings like hospitals, care homes, clinics, GPs, they will always be updated and modernized. Some of the changes could be the way the patients are assessed, applying technology to patients and service users, preparing the new registrants, and the way the professionals learn and develop themselves. The regularity and the professional body provides support and advice for professionals to maintain the continuous professional development. Details of standards that must be met are provided, which includes how many hours of continuous professional development must be completed. They will also outline how it should be recorded and in what kind of settings it should be in. There are many activities that could be taken on to continue professional development. Some of these are observation through shadowing, which involves individuals observing a professional to acquire greater understanding of the job role and responsibilities. Attending conferences, it offers learning on specific topics. Attending workshops is a hands-on experience. Again, it's usually on a specific topic. Volunteering and also even work experience in other clinical areas. A reflection is a process of examining and exploring ourselves, looking back at actions and experiences that could help us gain awareness about what the individual has done or gained so far. It is a powerful tool which helps enable to develop and understand the way we learn. Reflective practice to gain more experience will make us more successful in judging situations. Critical incident analysis. A critical incident is an experience that involves an unexpected or sudden situation that has occurred. In some cases, it could be a very serious outcome, and in some cases, it could even be a threat to life. Critical incident analysis will include the circumstances and surroundings getting analysed while focusing on the incident. The health and social care workers has developed critical incident analysis as a valuable tool to be able to aid critical reflection while practicing. There are different types of reflective models that can be used to analyze critical incidents. Some examples are Bowles triangular representation, Gibbs reflective cycle, and Atkins and Murphy's cyclical model. I have used the Gibbs reflective cycle to analyze a personal critical incident that I have experienced in the past. I was working as a carer for an agency in North London. I was called to cover one of the senior nurses for an hour. When I arrived at the service user's house, I introduced myself and asked the senior carer where the service plan, the care plan, was located. After the carer left, I read through the care plan to gain more information about the service user, and I started to have a conversation to get to know her a bit better. Halfway through the cover, she asked if I could help her to use the loo. She is a Zimmer frame user, so she was walking slowly towards the bathroom, and I went to open the door for her. By the time I turned back, she lost her balance, fell backwards, and hit her head on the corner of the wall. She was screaming in pain, crying. I tried to, assure her and tell her to stay, try to be calm. But she was too much in pain. I had to call the ambulance and informed my manager of the incident. Hearing her cry was really hard as it was upsetting me and I felt stress. As she was laying on the floor, she had an accident as she could not make it to the toilet. And she kept saying, sorry, and, she just looked very embarrassed. I just kept saying to her, no, it's fine. It happens. I will get a blanket and just cover you to make you feel more comfortable. So I went to the bedroom, got a blanket and just covered the wet area. I kept talking to her and calmed her a little bit, but she was still in pain. When the ambulance arrived, they said it would be best for her to go to the hospital to get checked out. So I got her a little bag ready with clothes and underwear. The senior carer arrived and was shocked at what scene she just walked into. I asked her if I could just have like a private talk so I can explain the situation and make her aware of what has happened. She said she will go to the hospital with the lady. I asked me if I could fill in the incident form, which I agreed to do. This experience has made me realize that I need to learn how to control my feelings. At one point, my eyes watered, and I believe that when the service user saw that, she felt more upset, which upset me afterwards. A few days after the incident, I decided to look online to find stress management courses to help me control my stress levels and my feelings. I wanted to be prepared for any critical incidents that may occur in the future. Core employability skills are essential to succeed in every job. They are known as soft skills, regardless of experience and previous trainings. They will make an individual become the employee who is desired and wanted by any organization. Some of these examples are communication skills, teamwork, being reliable, problem solving skills, taking own initiative, self management, leadership skills, and good knowledge of technology. These skills will help develop positive relationships, give direct and indirect emotional support. It will promote quality and diversity. Collaborative mindsets will value teams integration. A lot of positive that will help provide outstanding care for patients and service users. Employability skills that reflect on compassion, value, and behaviors in healthcare. These have been all used in the personal critical incident. Compassion reflects on skills such as resilience, critical thinking, communication, confidence, and cultural awareness. Values are part of the 6 C's: care, compassion, competence, communication, courage, and commitment. They are shared values and qualities that need to be demonstrated in all healthcare professionals. And the skills they reflect to is flexibility, stress management, time management, communication, teamwork. Professional behaviors. It involves the actions of healthcare workers modeling the appropriate response and behaviors towards other employees. It will reflect on skills such as communication, conflict resolutions, where you can just work together and solve problems, critical thinking, decision making, and empathy. In conclusion, this presentation has analysed practice developments in the health and social care sector. The distinctive needs, preferences, and values of the individuals are important, and by considering them, outstanding services will be delivered. Critical incidents being analysed using reflective models will help the planning of continuous professional development. A previous experience which has helped identify feelings, strengths, and weaknesses. Furthermore, use the experience to plan what actions I could take to update knowledge and skills to avoid critical incidents for the future. The core employability skills explored gives individuals skills to work and expand on. Compassion, values, and professional behaviours should be reflected on whenever possible to gain the best outcome of reflection. Thank you very much for listening to my presentation.